Good morning, everyone, and welcome to the Active Transportation Symposium panel called Keys to Pedestrian and Bicyclist Safety. We have a lot to share with you today. My name is Tracy Downing, and I work in the Division of Safety Programs at Caltrans headquarters. Before we begin, I wanted to quickly point out some Zoom webinar features. All participants are muted and your video feature is turned off. A quick reminder that this session will be recorded. We have 75 minutes for this session. We plan to present for no more than an hour, and then we'll have about 15 minutes following the presentations for question and answer session. We encourage you to ask questions throughout the presentations. Please ask your questions in the Q&A widget, not the chat widget. If you ask any questions in the chat widget, they will not be read. The chat is only for if you have any technical issues in which you need to reach the meeting producer. So again, please input all presentation related questions in the Q&A widget. In addition, there is a feature in the Q&A widget which you can upvote questions. So if you have the same question, or if you're really interested in having a specific question answered, please upvote that question, and the questions with the most votes will likely get asked first. So for today, we have 4 speakers on this panel, including myself. Again, I'm Tracy Downing, the Pedestrian and Bicyclist Safety Specialist in the Division of Safety Programs at Caltrans headquarters. Also speaking today is Courtney Aguirre, Performance Strategy Program Manager at the Southern California Association of Governments, also known as SCAG, followed by Tracy McMillan, an Associate Principal at NelsonNygaard. And finally, Charles Brown, founder and CEO of Equitable Cities, a minority and veteran-owned urban planning, public policy, and research firm focused at the intersection of transportation, health, and equity. If you want to know more about us, you can read our bios at the ATRC Active Transportation Symposium website. So let's get started. I'll kick it off with my presentation. So I'll just go ahead and provide a brief overview of what I'll cover today. First, we'll look at data related to the rise in fatalities and serious injuries. Then we'll look at our efforts as a state to pivot our approach to traffic safety. And finally, I'll go over some key action items that Caltrans is taking on as part of our California Strategic Highway Safety Plan. In California, safety is always our top priority. However, our numbers have been trending in the wrong direction for some time now. Every year, about 3,600 individuals die on California's transportation system, which includes all public roads on and off the state highway system. This averages about 10 deaths per day, and about 3 of those deaths are our most vulnerable road users, people who walk and bike. We can't normalize this, and we need to do better. We need to do things differently, and now we are. We knew that we had the knowledge and tools to support our vision of 0 fatalities and serious injuries on California's roads, but we needed to shift priorities, especially in difficult trade-off decisions and in this increasingly strained funding environment. Our shift began last year as we critically reevaluated our old approach to traffic safety and came up with a new approach. So this chart shows the total fatalities on California public roads. Pedestrian fatalities are the light blue portion of the bars, and fatalities for all other modes are shown in the dark blue bar. The red trend line tracks the percentage of fatalities that is pedestrians over time. So as you can see, the pedestrian percentage of total fatalities is on the rise. And this far outpaces the pedestrian mode share, making this an increasingly disproportionate safety impact for California pedestrians. For example, in 2012, according to the California Household Travel Survey, pedestrian trips made 16% of total trips, yet pedestrian fatalities consume nearly 25% of total fatalities. In California, unsafe speeds is the 3rd leading cause of fatalities and serious injuries. For fatalities and serious injuries from 2008 to 2017, unsafe speeds was the third highest cause, contributing to over 26,000 fatal and serious injury crashes. That's why the partnership between Caltrans and all of you here today, focusing on engineering, enforcement, and education is really critical in addressing this problem. And as you can see here, the human body is really vulnerable and unlikely to survive an uncushioned impact at a speed of more than about 20 miles an hour. You can see that even relatively low speeds can kill or seriously injure a pedestrian unless the vehicle and the road environment take into account the physical vulnerability of all road users. The other curves illustrate the fatality risk and how it links to kinetic energy transfer. So an auto-to-auto head-on collision becomes fatal at higher impact speed than auto sideswipe or auto fixed object crashes. The takeaway here is that if speed increases, so does fatality risk. So we are pursuing a paradigm shift in safety for California, and this is a direct result of the rising numbers of deaths and serious injuries. We realized that if we wanted our numbers to change, if we wanted to reduce traffic fatalities and serious injuries to zero, we needed to change the way we do things. Our goal is to move the needle in the right direction to reduce fatalities and serious injuries to zero. So one way we're working towards this new safety paradigm is through the California Strategic Highway Safety Plan, which we call the SHSP. So the SHSP is one of California's highest level guiding documents, and it is a statewide data-driven traffic safety plan that coordinates the efforts of a wide range of organizations to reduce traffic accident fatalities and serious injuries on all public roads. So in coordination with federal, state, local, and private sector safety stakeholders, the SHSP establishes goals, objectives, and challenge areas. And you can see those challenge areas up here on the screen. The California SHSP includes 16 challenge areas, which helps to focus resources and efforts. And within those 16 challenge areas, I'm going to focus on 3 high priority areas based on the challenge areas. So speed management, aggressive driving, and then bicyclists and pedestrians. So these areas, like I mentioned, represent a large percentage of fatalities and serious injuries and deserve extra attention in order to start significantly reducing deaths and serious injuries. These high priority areas will have more detailed and frequent updates and analyses to support action development in the SHSP as we move forward. The first high priority challenge area I'm going to discuss is speed management or aggressive driving. I've already covered the alarming statistics earlier, which really depict the correlation between unsafe speed and increased risk in fatalities and serious injuries. So now I'll look at the actions underway to address this challenge. So the following actions are what we're doing right now to address speed management and aggressive driving related crashes. We are developing a speed monitoring program, and this is a new speeding related traffic safety monitoring program focused on reducing fatalities and serious injuries that are speeding related, so that we can truly expand on our focus on addressing speed and implementing speed management. Next is to implement a new roadway-based context-sensitive approach to establishing speed limits. So one of the SHSP action items related to speed management is a research project that launched earlier this year. And this comes from a recommendation in CALSA's Zero Traffic Fatalities Task Force report. One of the key recommendations there was to develop and implement this new roadway-based context-sensitive approach to establish speed limits. And then we want that to prioritize the safety of all road users. So as the first step, Caltrans initiated this research project, and it represents kind of the first step towards developing a safe systems approach to setting speed limits in California and replacing the outdated 85th percentile methodology and moving away from using driver behavior entirely to set speed limits. We also are implementing guidance from state and federal research. So Caltrans has also been monitoring the NCHRP research project development of posted speed limit setting procedure and tool for over a year, and the results have been released, and we're currently evaluating them and considering how to best incorporate them. And we're also enhancing technical resources, which includes enhancing web page development training and revising the California Manual for setting speed limits. So as you may know, the national standard for setting speed limits is based on the 85th percentile of existing speeds, which historically focused on vehicle traffic. So developing a new approach to setting speed limits is based on a safe system principle, which will take time. But in the meantime, we are exploring options to increase flexibility to account for all users in the area within the current framework for setting speed limits. And lastly, we're developing policies related to traffic calming and incorporating them into design guidance. So we formed an internal working group at this point that's currently developing traffic calming guidance, and the working group is drafting that guidance specific to California and is also coordinating with FHWA. So part of this effort will be laying out the needs or the criteria for traffic calming interventions. So pedestrians and bicyclists, like I mentioned, are our most vulnerable road users, and our guiding principle to integrate equity relates to this challenge area and takes into account historical, present day, and systemic biases so that safety is improved for all groups, particularly the most vulnerable and traditionally underserved populations. Institutionalizing equity includes embracing the safe system principle that safety must be proactive. We must proactively address inequities built into the current transportation system to keep vulnerable members of the community safe. We need to ensure safe and fair transportation options for everyone. We now require that equity is addressed within the development and implementation of all actions within our Strategic Highway Safety Plan, or SHSP. In addition, we developed a working definition of equity for use in the SHSP as part of our collaborative process with our safety partners. We've clearly defined equity in the SHSP and have included it throughout the emphasis areas and actions. And the following actions are currently underway to address pedestrian-related crashes. So we are establishing a methodology for developing a high injury network for pedestrians and bicyclists, which you'll hear about next. We are also developing quick builds and demonstration project guidance to advance complete streets elements for multimodal user safety. And we are also developing pedestrian count models to improve volume data and accurately predict pedestrian-related crashes. And for our bicyclist challenge area, we are updating the California Complete Intersections Guide to provide current design guidance to Caltrans and local staff. We also have a proactive bicyclist systemic safety improvement program that's underway. And we have developed a bicyclist hotspot safety improvement program. So lastly, I wanted to add that all actions that we have mentioned today include an explanation of how they would address equity. And that wraps up my presentation. My contact information is here on the screen. It's also available through the ATRC website. And with that, I'll go ahead and hand it off to Courtney.
So good morning, everyone. Sorry, I was clicking on unmute on the other button. It wasn't working for me. Hopefully you're all seeing my screen. I'm just gonna start my slides in just a second. So as I said, good morning. My name is Courtney Aguirre and I work for SCAG, an agency that plans for about 19 million people across Southern California. And today I'm going to be walking you through information about high injury networks. But before we get started, I want to get a sense of where you're at. So we have a couple of poll questions for you. The first, are you familiar with the concept of a high injury network? Yes or no? And the second, Has your community developed a high injury network? Again, a yes or no, just hopefully a really simple question or simple set of questions for you to respond to. We could take about 30 seconds to 45 seconds, hopefully not too much time for you to respond. And so I'm not seeing results come in. Hopefully our host is, and our host can alert me as the poll is wrapping up and most people have responded.
All right, Courtney, looks like we have about 75%. I'm going to go ahead and end the poll and share the results.
Perfect, thank you. So it looks like about half of you are familiar with the concept of high injury network, but a good portion of you, a good chunk of you aren't. So that this presentation will hopefully be very meaningful for some of you and hopefully all of you in some ways as we unpack some of the details. And are you, so question 2, we could advance one more slide, or not a slide, I should say, but a result. We can see question 2, has your community developed a high injury network? And so this is going to be very interesting for me as a statewide group that I'm going to be sharing information about, has been trying to uncover all of the high injury networks in California. So I see a lot of results are coming in from you. For my part, I should note that SCAG does have a regional high injury network really developed at the county by county level, since we represent or we've planned for 6 counties. And so I think a good chunk of you have responded that you do not have high injury networks. And so hopefully this presentation today is going to be helpful for you. And the resource we're going to share at the very end is something that you can use as you consider developing one for your community. So I see a lot of you have responded again that you haven't developed one for you yet, but we do have some experts on the line. And so hopefully you can, chime in during the discussion portion or the question portion if you have any feedback for some of the questions. And so I'm gonna close out, hopefully we can close out the poll and get into the thick of things. Thank you. So there we go. Okay, so I'm excited to share some highlights from the work of a statewide group on developing recommendations for California guidance on high injury network definition and methodology. I know that Jesse covered some of this, but briefly, in a typical year in our state, we're experiencing quite a few collisions resulting in fatalities and serious injuries. Quite a few people are lost. These represent, people that we know, family members, friends, colleagues. And at the national level and in California, we've experienced some increasing rates of fatal and serious crashes, particularly in the last year, despite some lowered vehicle miles traveled, some lowered VMT. And with all of the traveling that's still occurring, it's not surprising, right, that these mistakes are being made and that collisions are happening everywhere across the state, and they're impacting drivers. And as Jesse noted, they are disproportionately impacting people who are walking, people who are biking, as well as those in our highest need communities. So there are many reasons why collisions are occurring, but as Jesse had noted, unsafe speed is a top contributing factor of all collisions, accounting for about 25 to 30% of all of our fatal collisions. And like many other states, our current procedures for setting speed limits in California are relying on the 85th percentile methodology. So speeds are determined by the speed that 85% of drivers are moving on a clear day, not by what is safest on a given road. And if enough drivers are going above the speed limit, the law says that the speed should be increased. And so given that speed is that leading predictor of whether you're involved in a crash or whether you survive a crash, changing speed setting methodologies and allowing our local jurisdictions, our local agencies more flexibility in lowering their speeds has the potential for saving lives. And so early last year, in what feels like a decade ago, January of 2020, California's Zero Traffic Fatalities Task Force released findings and provided recommendations focused on speed and how California could do better, including a recommendation that the state develop guidance on high injury networks. And so those of you who indicated, about half of you who are not as familiar with high injury networks, we're going to get into it. But for now, I want to share this. Why might a community want to develop a high injury network? Why might a region, a city, or a county do this? There are a lot of reasons. Some are highlighted on the slide, but I think the top two that come to mind are to motivate data-driven decision-making and to provide more information on where we can focus our limited resources. And I know for folks on the line today who've applied for ATP, you know just how limited those resources can feel sometimes, right? We all want funding for our work. And interestingly, and unfortunately, it appears that a very small subset of California communities have high injury networks. And so that's a concern for some of us who are really looking at the numbers, right? So recognizing the need to motivate the development of more high injury networks in California and to implement the recommendations from the state's Zero Traffic Fatalities Task Force, last November, I started convening a statewide group through the state strategic highway safety plan challenge area teams that Jesse was referring to, the SHSP. We worked together to catalog and review California's high injury networks and jumpstart the state's work on developing recommendations for high injury networks. We wanted to identify really every community in California that has a high injury network, and we wanted to understand how they'd been defined, the methodologies they'd used, as well as how they were being used in their communities to motivate decision-making. So our research culminated in a report that includes some recommendations for statewide guidance on a definition and methodology for high injury networks, and we're going to get into some of those details now. So the statewide group, as I said, was reviewing high injury networks from communities across the state at different levels of government. The case studies are highlighted on the slide before you. We selected a sampling of cities based on their size, geographic size, as well as their population size. We try to include a good assortment of cities, counties, and regions. And so here's what we found. In reviewing the high injury networks, we identified a common definition. So for those of you who aren't familiar with high injury networks, this should hopefully be illuminating for you that a high injury network is a network of designated corridor level segments where the highest concentrations of serious and/or fatal collisions are occurring. So those worst types of collisions. And a high injury network represents a defined prioritized subset of the overall transportation network. So it's not your entire roadway network, it's just that subset where you have those really high concentrations of collisions occurring. There we go. So based on a review of California's high injury networks, we found that there are some core components of high injury networks, specifically the number of years of data, typically 3 to 5, though at times there's much more data considered. And in California, many jurisdictions are depending on SWITR's data, sometimes TIMS. High injury network analysis is typically on corridors that are continuous and have comparable collision patterns or densities. And sometimes, though not as often, additional intersection analysis is conducted. So high injury networks consider roadway facilities for which a jurisdiction typically has the authority to set speeds, though not always, but often. And at minimum, high injury networks consider all modes of serious and fatal collisions, but especially our vulnerable road users, those bicyclists and pedestrians that Jesse was referencing that are disproportionately impacted by collisions. And for high injury networks, there is an overall threshold. So high injury networks represent a subset, again, of the overall roadway network. And in developing a high injury network, a critical core piece should be equity, right? Though what we did find is that it is not often taken into account, or at least in our research, that's what we found. And so a jurisdiction could document how much of the proposed high injury network is falling into a high need community, a community of concern, a disadvantaged community. I know the terminology differs up and down the state, or in some cases you could weight these collisions more heavily, right? So that they were definitely represented on your network. So those were some of the core components that we identified. And then we know that there are challenges, right? And we wanted to understand what those were and why more communities perhaps weren't developing their own high injury networks. And so we found some challenges which are highlighted on the slide before you. One key one is accessing reliable or timely collision data. And even in cases where you may have that reliable data, perhaps you don't have concentrations that are enough to develop a high injury network. So that occurs for some of our smaller jurisdictions who may have very few historic collision records. And in those cases, a systemic analysis may be more appropriate. And we do describe in a bit of detail what that could be within our report. Another challenge is that our stakeholders in the public may not understand what a high injury network is and how it affects them. And so some education is certainly necessary, and some outreach and engagement is as well. And I'll get into more of that in just a bit. And some jurisdictions may lack collision database software for collision record keeping and analysis, or GIS software, or they don't have the staff and resources to do this work. And so we can talk a bit more about that in a bit as well. And finally, some jurisdictions have risk and liability concerns related to identifying what may be perceived as more dangerous portions of the roadway network. And so that's a challenge that can be overcome. Many cities have, but it is a significant challenge for some. And then it's again, the final piece I'll point to is the potential for over-policing. High injury networks can be used in a variety of ways. They can help motivate data-driven decision-making, but there is concern for some communities that they may be used in ways that are not helpful for our more high-need communities. So that's certainly something that we need to be mindful of as we develop high injury networks. In terms of, let me see, sorry. There we go. So the final point I'll raise for the challenges is the limitations of our data. We know that in developing high injury networks, there's this obvious intent of wanting to motivate more data-driven decision-making, but we need to be mindful of the limitations of our data. We know that there's underreporting of crashes, that there are errors in our collision reports, and that there is bias in our reporting, and that our collision data may not accurately reflect the roadway safety experiences among our more vulnerable road users. And we do know that a large chunk of our crash data is not currently disaggregated by race and ethnicity. So there are biases in the data and those who are interpreting and using the data. And so it's very critical to understand the limitations of your data as well as to ground truth data. And that's where your outreach and engagement comes into play as you develop your high injury network, and reaching out to communities that are more impacted by high levels, high concentrations of crashes. So with that, we'll get into the recommendations. So we went through all of this research, cataloging the high injury networks, and developed this resulting definition. The recommended high injury network definition is on the slide before you. Really, again, it's pointing to what we've already been talking about, that it's a network, it's the highest concentrations of your more serious and fatal collisions. You're using a chunk of data to define it, and it's a prioritized subset of your overall transportation network. Typically, I think that's about 5 to 20% of your network, certainly not exceeding 50% of your network. In terms of the methodology, in addition to the definition, we also identified, again, those core components and standards as part of a recommended methodology that you should include 3 to 5 years of data, which could be sourced from SWITR's, jurisdictions established database for collecting data, or TIMS. They should focus on corridors that are continuous and have those comparable collision patterns or densities. And again, ideally, you have authority over setting speeds on the roadway networks, the roadway network that you're identifying, and you should be accounting for multiple types of modes, but especially bicyclists and pedestrians. And as I just mentioned, it's a subset of your overall network, maybe 5 to 20% of it. And you should definitely take into account equity as you go forward, and as I had previously described. And so the final point I'll make here in terms of the methodology is just pointing to maintenance, because once you establish a high energy network, it's not over, right? You continue to be receiving and downloading a variety of safety data. And so updates are needed as you acquire new data and as your communities undergo changes, right? As infrastructure is developed and changes roadways, as speed limits are changed, as land use characteristics changes. And typically, we're seeing a refresh of these, over a cycle. And so you need to define that for yourself, what that could be for your community. And so in terms of the implications of this work, Caltrans is now reviewing these recommendations and considering how they can be institutionalized at the statewide level and perhaps the California Manual for Uniform Traffic Control Devices. And we are quite interested in motivating more local jurisdictions to develop high injury networks and value them, as they can drive that data-driven decision-making. And this is particularly important as Assembly Bill AB 43 was just signed into law by the governor, which I know someone has populated within the chat information about. But this would allow local jurisdictions, cities, counties, to lower speed limits along accepted safety corridors or perhaps these high injury networks. So it's really critical that our communities consider developing their own high injury networks so that they have more local control and flexibility over lowering speeds. We also hope that high injury networks could be used by state, county transportation commissions or MPOs, that they consider whether high injury networks are a factor in projects that are submitted to them in the project scoring. And all of this, right, is wrapped up so that we can hopefully motivate progress towards achieving zero fatalities and serious injuries. And so in terms of the report itself that I've been referencing throughout, if you'd like a copy of the report, you can certainly access it online. And so I know we're going to load that in the chat for all of you. So if you'd like to take a peek at it, if your community has one, it might be interesting for you to see how others have developed theirs, look at those case studies. If you haven't developed one, I'd encourage you to look at the very back of the report where we have some jurisdictional guidance, a readiness checklist of sorts, so that you can assess if you're in a position yet to develop a high injury network, or what you might need to do, what funding you may need to secure in order to develop one for yourself. And so with that, I think I can wrap up. My contact information is here. Again, you should be able to access that report if you're interested in learning more. And I want to hand it off now to our next presenter, Tracy McMillan of NelsonNygaard.
Courtney, thanks so much for the handoff. Let me get my screen going here. All right, great. Is everyone able to see my screen? Wonderful. Thanks so much for the opportunity to be here today to present to you. And thank you also to the ATRC team for inviting me here to talk about non-infrastructure projects value and transportation safety. As Jesse mentioned at the beginning of the session, my name is Tracy McMillan, and I'm an associate principal at NelsonNygaard. We're a national multimodal transportation planning firm that was founded in California, and we have offices in Northern and Southern California. As I mentioned, I'm going to talk about the role of non-infrastructure projects in transportation safety and using the Safe Systems framework or approach as a framework for the discussion. I'll feature also a case study of a project that we've done in Stanislaus County with Stanislaus Council of Governments, which was a non-infrastructure project funded in cycle 3 of the ATP. So the first thing I want to talk about is this idea that safety improvements don't only come about through infrastructure changes. Non-infrastructure projects and activities are really important and can impact each of these safe systems elements. Design and infrastructure is obviously very critical, but it needs to be supported through policy and programming to lead to culture change in safety, from policymakers to professionals to the public. For example, policy sets the stage for safe vehicle design, and legislation such as the recently passed AB 43, which was referenced in the past 2 presentations, is an important infrastructure tool in the local jurisdiction's toolkit, as Courtney just mentioned, that will hopefully bring about safer speeds on local roadways, particularly the high injury networks that she talked about. Lastly, programming, like I'll share from the Walk and Safe Stanislaus education campaign, is really important to shift the road users' consciousness on transportation safety. The other point I want to make in this presentation, I'll talk a little bit about how we use qualitative data throughout the Walk and Roll Stanislaus project, is that qualitative data is so important to inform change in both infrastructure and non-infrastructure projects. Qualitative data like that collected through conversations that are both formal, like focus groups and stakeholder meetings, and informal, like you might have when you're conducting walk audits in communities, observations of road user behavior and the built environment that road users have to navigate. It's really invaluable to ground truth the information that's gathered more quantitatively. Courtney talked about this a little bit in her presentation, talking about the high injury network and crash analysis and ground truthing that information through engagement and outreach, because that is, we can understand individuals and road users' lived experience when they're utilizing the transportation systems in their community, in the region, and around the state. So as I mentioned, the primary discussion that I'll have in this presentation is to feature the Walk and Roll Stanislaus non-infrastructure project as a case study that highlights the use of safe systems approach and qualitative and quantitative data when designing the various components of an educational campaign. We were fortunate to work with Stanislaus Council of Governments on this project, and it ran from this summer, or I'm sorry, not this summer, the winter of 2020 through the winter going into early 2021. StanCog was awarded a non-infrastructure grant in ATP Cycle 3 to design and launch a regional ped bike safety and education campaign. The goals of the project were to increase awareness and empathy of road safety for all road users and to encourage behavior change for all modes. As I mentioned, this project involved quantitative and qualitative data. We did the traditional study of existing conditions in the community, primarily using quantitative data such as sociodemographics, a crash analysis, looking at health data that was available, land use, the land use of the county itself. But we also conducted 6 focus groups and an online survey to, again, to bolster the data that we've collected quantitatively and to help ground truth that information and the findings that were coming out through some of that existing conditions analysis. So some of the questions that were asked in the focus group and surveys were, where are you or others in your community currently walking and bicycling? Generally, do community members feel safe or unsafe when they're walking or cycling to a destination within the community? And if so, why? And what do you think are the major community concerns related to safety when people are choosing to walk, scoot, skateboard, or cycle as a form of transportation? Some of the key findings through the focus group and the online survey were generally the people do not feel safe walking and biking in areas of Stanislaus County. Community leaders and public safety officers in focus group participants felt like community leaders and public safety officers needed to change the narrative and create a narrative that creates more empathy towards cyclists and pedestrians. In terms of messaging, the idea that streets are for everyone was a message that resonated, that would be helpful to remove the stigma of cyclists associated with cycling and walking in the community. And the idea that it's important to educate all road users on the rules of the road. I should also note that the focus groups were conducted throughout the county, so it was representative of the different communities that were within the county, and there was a particular focus on disadvantaged communities within the county. These findings through the focus group and the survey, as well as the existing conditions analysis, really helped to shape the activities that followed that were targeted towards different audiences to try to affect change within the community. The activities that we'll talk about next, again, were all non-infrastructure activities, and they included a train the trainer activity, development of website and various engagement activities, an advertising campaign, a toolkit, and an active transportation summit. So the train-the-trainer activities, originally, I'll also say this project, as I mentioned, started in early 2020. So about 2.5 months into the project, we were introduced with the challenge of a global pandemic and sheltering in place. So the activities that were designed originally in the grant and the project to be in person had to shift to being online. So the train-to-trainer activities was originally designed as a in-person training that then would be carried forward into open streets activities. So the trainers that were trained could then have an opportunity to share their training and their knowledge in the community. That had to shift to an online training activity that was successful and trained a small group of volunteers on the rules of the road and the goal of to increase for them to be able to carry forward to individuals that they work with going forward to help them increase confidence in traveling by bike. As I mentioned, since we had to go to online engagement instead of in-person engagement, like through the open street activities that were originally planned as part of the project, we did create a website for the project called walkandrollstanislaus.com that is still live. And this was a pivot that we made with the community partners and our advisory council and SCAG to create this website, which really allowed for more sustained engagement and messaging over the project period than we likely would have had if we had had point in time open streets activities at the set times that they were designed to occur in the original proposal. The website features activities designed for all ages and abilities that are meant to engage people in a dialogue about road safety. For example, the website features a road rules quiz to increase knowledge and dispel misconceptions about road user behavior and rules. It features 5 questions that people can answer, and they can get a little badge for participating in the road rules quiz. The website also featured a scavenger hunt, which encouraged Stanislaus County residents to go out into the community safely, and at that point in time, and a bit still now, masked and socially distanced, to look for transportation safety and place-making aspects of their community. The scavenger hunt was promoted via social media posts by SCAG and community partners to help encourage people to participate in the activities. Another major component of the project was an advertising campaign. The messaging was informed by the focus group and survey findings and tapped into the shared responsibility aspect of the safe systems approach. It was coincidentally an important public health message during the pandemic too. The messaging that was decided upon was this concept of we're all on this road together, let's put safety first. And the campaign was produced in both English and Spanish and included billboards throughout the county, mobile ads, digital and radio ads, newspaper and bus advertisements on local media channels and transit providers, and a television ad that played for 4 weeks on regional PBS stations. Let me play this video quickly. And this is the one that was featured on radio stations.
Pals. It's looking like another fine day in Stanislaus County. Whether you're walking or rolling, take a tip from me and make safety your priority. If you're cruising by vehicle, cut out distractions. Stay focused and watch your speed. If you're walking, running, or biking, stay alert and aware of your surroundings. Test your road safety knowledge and win prizes at walkandrollstanislaus.com, because we can do better if we work together.
The campaign was designed, again, the messaging was informed by the qualitative data that we had collected earlier in the project, and it was also informed by the car culture and history in Stanislaus County. American Graffiti was based in Modesto. That's where George Lucas got the inspiration for that movie. The primary audience of the previous activities was the public, and the last two activities of the campaign were geared more toward professionals and decision makers. The Active Transportation Summit convened local and regional elected officials and agency and advocates in both public health and transportation planning, and was framed around the safe systems approach to encourage presenters and panelists to discuss the need for a paradigm shift in bicycle and pedestrian safety and engineering. The project also produced an active transportation toolkit, which was targeted to professionals that featured strategies and resources such as funding opportunities, programming and data sources to support bicycle and pedestrian safety within Stanislaus County. I want to thank the StanCog team for the opportunity to work on this Walk and Roll Stanislaus project with them, and also our great partners in Consulting and Walrich Creative Communications in the development of the project. Thank you all for the opportunity to talk to you today, and I'll now pass it on to Charles.
Thank you, Tracy. Thank you, Courtney, and the other panelists as well. Give me 1 second. All right, welcome everyone. Again, my name is Charles C. Brown. I'm founder and president of Equitable Cities, where I work at the intersection of transportation, health, and equity. You've heard a lot in this presentation today about the data, which shows the disparities in traffic fatalities throughout the state. One of the things I want to do is build upon two earlier comments. The first one was by Courtney, which was the importance of ground truthing the data. The second one was by Tracy, the importance of considering not only quantitative data, but also qualitative data. I think too often when these conversations are had, you're always left wondering, what are the people that are most vulnerable by these transportation decision-making processes, thinking? And so what I bring to you today is an inside sort of look at what Black scholars in transportation, health, and in land use are thinking in regards to improving safety and thus increasing physical activity on our roadways. I want to offer a very brief disclaimer that this was a project supported by the Centers for Disease Control and Prevention. So in this presentation, what I'll do is cover a number of findings from my conversations with Black scholars from around North America. I'll touch briefly on their characteristics, but dive deeply into some key topics here, such as what do they think about safety and the duality of safety, institutional and systemic racism, what would be their priorities, and then how we can go about outreach and communication in a way that is most effective. So in engaging with these groups, the members of these focus groups, there were three key purposes. First, to understand their expert discussions around the historical context and the consequence of inequities that have discouraged safe physical activity among Black individuals and community. Secondly, understand the barriers, the racial inequities, and the factors related to activity-friendly routes to everyday destinations that encourage or influence physical activity among Black individuals and communities. And then lastly, identify opportunities for not only DOT, but also the Centers for Disease Control and others to embed equitable access to physical activity opportunities for Black communities into their programs and strategies. So my methodology consisted of 1 hour one-on-one interviews with these thought leaders. In total, there were 9 of them, and I used a series of methods to recruit them, including email and LinkedIn and one-on-one phone calls. These took place from May 2021 through June 2021, and I received verbal and written consent from them to do the recording and summarize the focus groups. I also paid them for their time, which is a key component of doing this equitable work. Lastly, I downloaded and transcribed the interviews using some modern technologies to do so. In terms of the Black scholars and thought leaders, 2 here represent the beautiful state of California, Tamika Butler and Warren Logan. Others, again, all are considered thought leaders in either public health, transportation, and or land use. And we have represented here on this screen members from throughout America. So every region, I think except one, is represented here. In terms of the findings, I'll now go into what they thought as it relates to these multitude of topics, ranging from why did they get into this career down to what would be their outreach and communication recommendations for government. I want to start though with saying of the 100 top words that they spoke, what they spoke most about was the importance of people, in centering people not only in our transportation decision-making processes, but people over everything was the statement. And not just people in a general sense, but speaking specifically to the importance of addressing the issues of those most vulnerable, that being Black, brown, and low-income populations. Because if our message is safety for all, how are we hurting those who are most vulnerable? So moving into findings from the interviews, why did they choose the career they chose? Many of them chose it because they felt a divine calling or a sense of being chosen to actually do this work. Most importantly, though, they had a passion to make a difference. And so when you think about diversifying your staff, et cetera, I put this here, I left this here because I want to encourage you to go and recruit Black and brown people, elevate them into positions of power within the organization, because they're truly there to make a difference for all, but particularly people of color, whom are most, unfortunately, who are disproportionately affected by our transportation decision. In fact, one of them stated the importance of not just being reactive to situations, which too often our industry is. They feel the need to be preventive. And this is shown here in the quote that the desire was to prevent disease versus treat it. Then we move to white dominated spaces. A lot of these conversations, whether we know it or not, are white dominated. And their response with that is that it's interesting, it's tough, and it's eye-opening. But they've been prepared to navigate this and to expect this by family members, so much so that they're not intimidated by being the only one, but it's certainly not as comfortable as you might imagine. In fact, a person said to me that, oh dear, it's tough, meaning it's tough to work in that environment. So think about the fact that these spaces are white dominated, and oftentimes you don't hear from people like myself and others as it relates to the solutions. Then let's talk about quickly the COVID-19 pandemic and physical activity. They shared that this pandemic had an overall negative impact on their physical, mental, social, and emotional health. So while many agencies are working quickly in a post-George Floyd era to address safety issues, think about the multi-layer of stress that is upon people of color as they're fighting with what is happening in society, while at the same time trying to be professionals and do this work. They stated that it wasn't just a pandemic, it was a pandemic layered with Black death upon Black death upon Black death. That takes me to some of the COVID-19 pandemic and recent interventions that were considered safe in our industry. I want you to know that they view these interventions with a high degree of skepticism. So you get this sort of feedback when you diversify the audience. What may be deemed a best practice to the majority may not be deemed as a best practice to those most impacted. They noted the importance of centering racial equity and inclusion, not in the latter stages, but in the earlier stages of this work. In fact, one of them stated that 15-minute cities, which is growing in popularity, are typically areas where have left out Black and brown communities. So think about the gravity of that statement as it relates to these new interventions and their popularity, which takes us then to routes to destinations, plans, and policies. So they viewed safe routes to school and complete streets much more favorably, maybe unsurprisingly, than they viewed Vision Zero. But this was due to the racialized and discriminatory enforcement concerns that are present throughout this presentation. They noted too that oftentimes we deem things complete, yet they're not accessible to the degree that they should be for our disability community. And they stated quite candidly that they would love a complete street, give them a green bike lane and a red bus. Now, this is sort of counter to what you usually hear in terms of bicycle lanes being white lanes or the fear of gentrification. Again, oftentimes it's not about the infrastructure itself, it's about the potential for there being a sort of erasure of culture and history. Then that takes us to law enforcement. Many programs are still putting forth or leading with law enforcement as a sort of safety countermeasure. And they viewed law enforcement, maybe surprisingly, unsurprisingly, unfavorably. And they were taught at an early age how to interact with law enforcement, given their fears, not just in a post-George Floyd world, but in a pre-George Floyd world. But they were not just concerned about law enforcement, they were also concerned about self-deputized citizens and how they enforced the movement of Black and brown people in California and across the country. And if you're looking for more information on that, you can follow my work on arrested mobility. But they also discuss gender-based concerns, particularly for Black males as it related to law enforcement. As one person stated, I don't know of any Black male that hasn't had a negative encounter with law enforcement, which takes us to the other part of safety, traffic safety. What we found is that most of them feel happy biking, walking, etc. However, when you do a comparison between traffic safety versus personal safety, what you find is that traffic safety is actually less of a concern for many of them than personal safety and enforcement. They also shared literature with no concern for public transportation. And it was important to note that many of them shared how being a female in traffic actually comes with benefits. So we've discussed here somewhat tangentially the importance of equity, but also intersectionality. And what this shows is that there are male, female, and non-binary considerations that we must discuss and talk about when we discuss these findings, which takes us to personal safety. The personal safety piece was more of a concern for female. Traffic safety from a law enforcement standpoint was more of a concern for males. And these personal safety concerns impact the way they dress, the way they behave, and also how they choose and where they choose to go in the time in which they choose to do this. There's also colorism, the advantages and disadvantages of being lighter skinned or darker skinned people of color, and how that plays out in transportation and mobility decisions, safety, as well as enforcement. And it was stated that I know I have friends who won't go many places in the dark because they've been raped. They've been assaulted many times. So many of you may be asking, what does this have to do with traffic or transportation safety? It has everything to do with it. Because if there are particular streets that you may deem safe, but are not deemed safe by the people most victimized, they're still going to avoid those places for places that are much more desirable. So we have to consider the duality of safety, not just traffic safety itself, which takes us to, if they had all the powers in the world, what would be their top priorities? Their recommendations fell into 7 key categories. They would focus heavily on community outreach and engagement, political challenges at the state, at the federal, state, regional, and local levels, educational opportunities, as well as economic and financial stability. But their partnerships would be vast. It's not just talking about local advocacy, it's about all of the potential partnerships that you can engage in, from advocacy to business, to community-based organizations, to academics as well. Then what we find is that their top priorities is, let's dedicate funding, federal funding for sidewalks and for bicycle infrastructure. But let's also send money directly to cities, because what they're finding is that there's a misalignment in philosophies where the state partners are wanting to build highways and spend billions to build them, whereas they see an opportunity to give this money directly to cities to create better walkable neighborhoods for their residents. Building up on this, they feel that government's role to address these issues is to focus on diversity, equity, and inclusion by hiring more people of color, and also to increase funding for active transportation-related infrastructure. But not just that, given a unique connection between housing and land use, they want to also invest in housing, green spaces, and then other basic services such as water and energy, and always provide incentives for certain modes of transportation, in this particular case, sustainable modes. And as I wrap up here, they want to also increase resources to these local governments, as I stated earlier, for the implementation of those interventions. And so they feel that government can collaborate not just internally, but externally as well across the various federal departments, and update and create model policies related to active living and safety. We talk a lot about the need for policy, but what are the model policies, and are they being created and promoted in a way that addresses concern for Black and Brown people? And so when it comes to outreach, they discuss the importance of messaging not being led by many of these agencies that include CDC, because there are inherent to this trust concerns due to historic as well as contemporary issues. They viewed active members of the community as the preferred voice over your quote unquote experts. They also revealed that most success came from using multiple social media outlets. So this is not just one community or social media, it's not about just having one strategy around public outreach and engagement. It's about having multiple. And they rely upon faith-based organizations that serve youth and seniors, as well as street teams. And so they think street teams would be a pretty cool idea for CDC, and I'm adding in their transportation agencies to do so as well, which is why I call myself a street level researcher. So to wrap up, it's important to go to the source, invest in the communities, and most importantly, elevate Black voices. And why is this important? Because Black scholars approach this work through an intersectional lens. It is what best reflects their lived experiences, and they want to invest in infrastructure. It is valued over the programmatic things that we bring up. And then lastly, there's a distrust and concern for whiteness in all settings, and this includes self-deputized citizens. So don't be surprised when the best practices coming from the best of our white brothers and sisters are not welcome, because they're not feeling as if they are addressing their concerns. And so to end on their quote, they stated, "Nothing for us without us." So we spend these conversations talking about who's most victimized. You've just heard from them in terms of what their strategies and recommendations would be. Here's my contact information. Thank you. And I'm going to turn things back over. Thank you.
Thank you so much. Thanks, Charles, for sharing this really important study with us today. We really appreciate it. And I also want to thank all our panelists for sharing the important pieces that really all play into this transportation safety picture. So with that, we will start our Q&A session. My name is Emily Abrahams, and I am a project manager for the Active Transportation Resource Center at Caltrans. And I will invite all our panelists to turn on their cameras, and we will go through some of the questions that were put in the Q&A box. Please feel free to continue adding questions, and we'll get through as many as we can. So to start off, a lot of people are interested in learning more about AB 43. So I wanted to ask our panelists who have knowledge of AB 43 and how it relates to your work that you shared with us today. Will it have any impact on near-term speed limit adaptations or adoptions, and when will implementation begin?
Right. So I know I brought that up. Jesse might be able to speak to it as well, as it does impact Caltrans' current activities and current work focus, especially in the next year or so. I put a link in the chat to the legislation text. So this was signed into law. I want to say in the past few weeks. Time is really hard to gauge right now. So I know it was in the past month. It was considered a huge victory for a group of statewide stakeholders who had been really, really engaged in partnering with Assemblymember Friedman and other legislators on passing this legislation, which we really, really hope is going to be impact for local jurisdictions. So as I mentioned briefly in my presentation, this is going to allow jurisdictions who have high injury network equivalents. I know they're defined as safety corridors within the legislation to potentially to lower speeds on these networks. So Caltrans has a significant task at hand that I'm hoping they're going to, really engage folks in as they develop what is going to become language defining what safety corridors are within the Manual for Uniform Traffic Control Devices. So specifically, again, what are safety corridors? How are they defined? Potentially what the methodology is. I know that report that we linked to in the chat does provide a lot of details on what the statewide group is recommending. And I know that that is considered, I believe, a departure point for Caltrans as they start this work. So again, hopefully there will be a lot of outreach and engagement from Caltrans as they develop that language within the MUTCD. The other important thing that this legislation does, besides tasking Caltrans to update the MUTCD to define safety corridors, is it will allow locals to establish 25-mile-per-hour speed limits in business and residence districts, and it's going to let folks at the local levels keep those traffic and engineering studies for up to 14 years versus the current 7. So I understand that's a pretty significant thing for many of our local jurisdictions who find that when they do update those traffic surveys, speed creep, right, comes into play, and they may have to increase speeds. So I'm going to defer to the state. Jesse, would you like to add anything further about AB 43?
Yeah, that was a really great summary too, Courtney. Thank you. I think I wanted to speak specifically to changes in the MUTCD and then also some of the things that we're working on at Caltrans. So I mentioned in my presentation that we are working on a speed monitoring program as well as traffic calming guidance. So we've got those two things that we're working on, as well as the NCHRP research project, which I put in the chat here. And you can take a look at. It's pretty interesting read. But because I think the recommendation was made in the CalSTA Zero Traffic Fatalities Task Force report, there's already been a lot of work happening. So I think someone mentioned in the Q&A, is there I think it was 2024 deadline for starting the implementation of this? And that's definitely a no, in my opinion. I think we've already been working towards this, and I wouldn't imagine that we would wait until that point to start releasing anything that could be helpful to both, Caltrans and our partners. And then as far as the MUTCD goes, we are actually working on an update for that. So both Part 9 and the marking section in Part 3. And we're asking for some recommendations to incorporate those changes at the November 4th CTCDC meeting. So there's a lot of things happening with both of those areas that I think will be implemented. It will take time. I'm not saying it will happen overnight, but there's a lot happening right now that would be implemented hopefully before that, before the deadline in the legislation.
Great, thank you. All right, let's move on to another question here. The question is, could you speak to prioritizing the safety for all roadway users as opposed to prioritizing the safety for vulnerable road users, specifically pedestrians and bicyclists, or by prioritizing the safety of race and age groups that are overrepresented in bike and ped fatalities and injuries? The question is also, what happens when safety for all is not possible, such as on a freeway off-ramp when traffic will back up? So it's kind of a trade-off situation, I guess, but how do we address prioritizing the safety for all roadway users?
Emily, did you want me to take that one?
Sure, yeah, whoever wants to speak on it, you can start.
Okay. I think one of the things that a couple of things that we're working on. One that I wanted to highlight specifically is our Caltrans, sorry, I can't think of the name right now, but our basically our plan to adopt a Vision Zero policy. So we're looking at that as well as, specifically promoting safety for bicyclists and pedestrians through our bicyclists and pedestrians monitoring programs. So those types of things I think would sort of address that question. And then also, working really closely with, our districts at the project level and really doing a lot of training to get them to see you know, that prioritizing our most vulnerable road users is a priority for the department. And so I think those few things are some of the things that can help sort of change the culture. And I think that's really what we're trying to work on at this point.
Emily, I would like to chime in here. I think that's a very good question and statement by whoever asked that. Certainly, you know, from a governmental sense, in a democracy, or just in general, just as good human beings, we do want safety for all. I think we're all on the same page there. However, in the context of traffic safety, it's important to note that having a message around safety for all potentially comes off as in the same way as all lives matters versus Black Lives Matters. The reason I say that is because when you look at the stats, a disproportionate number of the people killed are people of color. And what is needed is a hyper focus on addressing the disparities in the crashes, not just a safety for all message. And in addressing these disparities in crashes, we need to see a larger share of the funding go to the greatest need. And the greatest need is in those very communities, the Black, brown, and low-income communities. So yes, safety for all. However, let's not sacrifice those most vulnerable in order to live out that message politically.
Very well said. Thanks for including that. All right, let's move on to another question. And this one may be for Courtney and Jesse. In your presentations, you talked about the different strategies or pieces of safety. So can you speak to the relationship between high injury network, LRSP, and also explain the acronym of that, and then the systemic safety approach?
Right. So Jesse, I don't know if you want to tackle this, but what I could offer is this, that there are deep connections between all three, right? I think that high injury network development is a part of a larger safety plan. It's not really meant to be an isolated component of how you address safety in your communities. You need to, you know, hopefully have a more comprehensive approach through a plan like a local road safety plan. Caltrans has been doing a really great job of funding a lot of those lately. I think they have I think the solicitation is fairly regular nowadays. So hopefully that's a funding source for many of you, if not through Caltrans Sustainable Planning Grants. And SCAG certainly has planning grants that we fund too for safety plans. So local road safety plan is perhaps the overarching umbrella that could house your high injury network is how I might describe it. Jesse, do you want to talk more about the systemic safety analysis?
Sure. Yeah, we're looking to, you know, actually implement district traffic safety plans, which would be in alignment with local road safety plans or high injury network plans. So I think that would be one key thing that we're working on at this point, not quite yet, but we're getting ready to start developing those district traffic safety plans over the next couple of years. So I think that would really be a key relationship between that high injury network and the systemic safety analysis. So the district traffic safety plans that we're anticipating developing over the next couple of years would include that systemic analysis. And that systemic analysis, I think, is really important in addition to those, like Courtney said, the local road safety plans and the high injury network.
I will also add that local road safety plans, or in some cases, if an agency has done SSARP previously that would meet the criteria or be equivalent to a local road safety plan, those are required for this next funding cycle to receive, to be eligible to receive highway safety improvement plan funds for California agencies. So it, as everyone said, a high injury network and a systemic methodology to looking at crashes are components of the LRSP, but it's important to have that LRSP in place if you would like to pursue highway safety improvement plan funds for this next cycle and going forward.
Great, thank you. And we may only have time for one or two more questions, but I wanted to ask this one of Charles. Would you support Vision Zero if it promotes automated speed enforcement only, ideally with wealth-based fines, not in-person police enforcement? And I know we didn't talk much about Vision Zero, but I thought this was a relevant question to ask as well.
Yeah, so full disclosure, I'm in support of Vision Zero, whether it does that or not, so long as it doesn't lead with enforcement. If it leads with infrastructure over enforcement, I'm in support of it. As it relates to automated speed enforcement, I'm also in support of that, so long as these speed cameras are distributed equitably throughout a municipality or region. So I wouldn't want to see a scenario where a disproportionate number of the cameras are put or placed in communities of color and low-income communities. Everyone should receive one, or every location should.
Great, thanks. All right, with that, we are right at 11 o'clock and we do need to prepare for our next session. So I wanted to end our session today. I want to thank all our panelists for sharing such amazing information. I think our audience for sure learned a lot. I also want to thank our attendees for coming to this presentation. I hope you did learn a lot. So thank you so much. With that, we will close this session and our next session begins at 11:15. So we hope to see you there. Thank you.